Per se, this oil doesn't have the capacity to grow your hair. You can lighten your skin tone, and this lasts for around a year or two.
And parlors do that as well?
Unfortunately, yeah. So I do Botox for my mother and I do Botox for my family, and it all depends on when the bride and groom are having the final function and when they come to me. The breast implant, in fact, helps you to detect them early. The only thing which actually can increase or decrease the size of the breast is, and it gives you the best anti-aging and strong, nice, shiny, healthy skin.
Welcome to All That Matters, the podcast where we explore ideas, stories, and insights that help you live your best life. Today, we are thrilled to have Dr. Saumya Nayak, a board-certified plastic, cosmetic, and hair transplant surgeon, as our guest. In this episode, we uncover the truth about trendy procedures like Botox and fillers, myths versus facts about hair transplants, oils, and gummies, how cosmetic surgery transforms lives, and what you need to know before considering a procedure. If you've ever been curious about plastic surgery or want to know how it can enhance your life, don't miss this episode. Hit subscribe now and stay tuned for incredible insights from Dr. Saumya Nayak. Let's dive into today's episode of All That Matters, where we talk all about things that truly matter in living a confident and fulfilling life. So welcome to the show, Saumya sir.
Thank you, Rudrik. Thank you, Tirth. So my name is Dr. Saumya Nayak. Hello, friends. And I am the owner and director at Luxor Hospital, which is at Vadodara, Gujarat. And by training, I am a plastic surgeon. I specialized further into cosmetic surgery and hair transplant surgery.
What does a plastic surgeon and a hair transplant surgeon actually do?
A plastic surgeon basically deals with two types of cases. One is a reconstructive surgery and other is cosmetic surgery. I started as a reconstructive surgeon and then trained into a cosmetic surgeon, which is my passion. So I now do cosmetic surgeries from head to toe, starting from hair transplant to toenail surgeries, and we try to give people what they want. So we say that be as you wish to seem, and that is what I do.
That's perfect. So if we just want to dive straight into the conversation, and if we'd have to ask, what are like the in procedures in today's time? What people do a lot at this time?
Yeah, so basically both males and females both look for cosmetic plastic surgery. I would say the most in thing for males these days is hair transplant. People know the magical results of hair transplant surgery and it transforms you like anything. And I've seen that there is no stigma around it. Even the males go out and discuss very, very fondly that I've done this and this is the doctor you should go to, and he's a rock star and you'll get results. For females, it is, I would say, still body procedures. Generally, ladies after marriage, their bodies change a lot. So mommy makeover is very common, wherein their tummies get out of shape. They want to get back into shape. Breast surgeries and lasers. All sorts of lasers and medifacials are in.
So when you say lasers, is it for hair removal or?
Yeah, so there are various type of lasers. We have a lot of laser machines in our hospital. Lasers are for hair and skin both. So laser hair removal is a very advanced laser which has various settings to it, and it removes your hair to a large extent. We say that laser hair reduction to almost 70-80%, and there are also skin lasers which cause skin resurfacing, which are known as the fractional lasers, surgical lasers, surgical CO2 lasers, Q-switch lasers, tattoo removal lasers, Hollywood facial lasers, so a lot more. So basically skin and hair both are covered by lasers.
Do you have to do it on a regular basis or it is a permanent thing?
So basically laser hair removal is absolutely the in thing. It is even, I would say it is even cost effective rather than going to a parlor every 15 days, 1 month for the rest of your life. So this takes around 6 sittings. Within which generally a normal lady will get easily 80 to 90% of response. The sessions are quite quick. If it's a small area, then it might be even 10-15 minutes, and if it's a whole body, then it takes around 2.5-3 hours, and you repeat the sittings once in 1 or 2 months depending upon the hair growth, and maybe 6 to 8 months is how long it will last, the sessions, but the results last very long. And maybe you just need maintenance sittings after 2 or 3 years for once or twice in a year. And it is really effective. The thing is, it is absolutely painless. It is absolutely painless. The procedure is very smooth. You just apply a cooling jelly. My girls are very, very well trained to do that, and they just do the laser, and you're off to your work.
Is there a question of some allergic reaction or something for people
I've
with
not
sensitive
seen
skin?
much here. It
No?
doesn't happen. So basically, these laser hair removal lasers primarily act on the follicle, the hair follicle. So it actually doesn't do much to your skin. And even the little bit of redness, if it happens to someone who's a very fair skinned person, it just goes off in a few hours.
So then when you look at these celebrities, when you look at someone in a movie showing off their body, they have no hair. How does that? It's like literally zero. So is it after one of these treatments, or is it's because they've done it for a very long time?
Yeah, so it is of course after one of these treatments, but as you know, there's a lot of modification which happens to these videos. So there's a lot of that play as well. Plus, of course, anyone and everyone, normal people do laser. So celebrities, absolutely everyone does laser hair removal. Laser hair removal, you shave off the hair first and then you do laser hair removal. So actually on screen you'll not see any hairs. So it is the magic of laser hair removal plus maybe some little video tricks too.
Of course, we can't miss out Botox when it comes to plastic surgery. So tell us, what is Botox and are there any side effects that people face?
Yeah, so basically Botox is by nature it's a protein. Yeah, so botulinum toxin, it's a protein. Clostridium botulinum, it's a product which this bacteria releases. But the medical science has become so advanced that they have gone ahead and made a medical use of it. So Botox, which is a toxin, is a protein which is injected very, very safely, painlessly into people where they have coarse facial wrinkles. So basically coarse means very hard. Like see, if I see of course I have not done Botox yet. So you see forehead lines. These are coarse forehead lines. Very fine lines are difficult to remove by Botox, but coarse lines can be removed by Botox. Botox goes inside and it causes an effect on the neuromuscular junction. So basically the lines which are formed is because the muscle moves. This protein, which is Botox, goes and covers the neuromuscular junction so that the action of the muscle itself doesn't happen. Once the action of the muscle doesn't happen, the wrinkle doesn't happen. So that is how it removes the wrinkle, and it is a very safe thing. See, it is basically protein here. It is something which the body is anyways going to break after 6 months or 8 months. So there is no permanent effect. Every effect is reversible. It is absolutely side effect prone as far as I have seen in my practice, and the worst it can cause is a mild headache or something, which a dolo will just solve. And there are various, all these products are very well tested before they are into human usage for years now. So I do Botox for my mother and I do Botox for my family, and it is absolutely safe. The only thing wherever a patient needs to check for safety is that they should go to the right provider. You select a proper cosmetic plastic surgeon who's been doing exclusively this work, and you go to them and then they are going to do the job.
When you look at Botox, who would you feel should get Botox done?
Botox in Western countries or even Korea and all, people starting from the age of 18 start getting it. Because of course they are advanced in their knowledge. They know what it does, they know how safe it is, and they know what it is for. So frankly, all people who have wrinkles can get Botox done.
Irrespective of the part of the body?
Irrespective of the age. No. So Botox is only done in upper 1/3 of the face. Full stop. Primarily, I am telling 95 or 98% of the usage is only in the upper 1/3 of the face. It is primarily for what is known as crow's feet, frown lines and the forehead lines. That is it. Botox is used for that only. Other very minor indications are there for genital rejuvenation and lot of other things, which forms maybe 2 to 5% of the cases. But Botox is done primarily for the coarse wrinkles of the upper third of the face. Anyone who is bothered by these wrinkles is the right person to get Botox done. Of course, we don't do this on kids. Anyways, less than 18 are never going to be bothered by that. Even I see in our demography, generally people beyond 30, 35, 40 are the ones who are sometimes more conscious about their wrinkles, and they want Botox and they get Botox. And Botox lasts for around 6 to 8 months, and it is a very quick fix treatment, and it gives you the best anti-aging and strong, nice, shiny, healthy skin.
What
as
are the
possible.
lip fillers then?
So the other thing like Botox is fillers.
Oh, that's different then.
That's a absolutely different thing. So
Okay.
fillers and Botox are two different category. Botox is to remove the wrinkles and hence cause anti-aging. Fillers is to basically fill hollows or fill areas and cause anti-aging. Yeah, so fillers can be used most commonly for the lip to plump up the lip and make them look proportional or even a little more than the lower lip so that it looks better. Fillers are also used for under eyes to remove the dark circles, hollows. They are used for cheek areas to lift up. There are various things. So basically, if I give you a basic simple example, if you're going on a road in a car, and if there are any what do you call khaddas, or if there are any bumps there, so to smoothen out the road, you fill something. So just like that, if there are deformities on your face, or if there are hollows on your face, or there are certain things which you want to enhance, so a filler is used. So a filler is a filler. Yeah, it goes and corrects those hollows and bumps and smoothens the things, and it gives you a nicer appearance.
Correct.
Yeah.
And recently we have also heard a lot about Korean glass skin. What's that like? Do
Yeah.
Koreans actually have very good skin, or as you mentioned, they are going through some procedure? What's
Yeah,
that?
so the first thing is, of course, they are blessed with genetics. Okay, they are genetically having a better skin, which is why they have termed it as Korean skin treatment and not Indian skin treatment, because genetics is very important, which I tell my people that you have to respect that. Suddenly I cannot do a treatment and make you into a Korean person. See, Korean skin treatment is because a Korean person is having that skin. An Indian is going to remain I'm sorry. An Indian is going to remain an Indian. The Indian skin will improve, but it is not going to become a Korean skin. Yeah. So first thing is you have to match the expectations. You have to match the reality to reality, and then we start doing various treatments depending upon where the person is starting from. If he or she has very bad acne scars, then you have to treat those acne scars and bring them to normal first, and then take to the advanced level. Right. So there are various skin treatments and skin products which, when done sequentially over a long time in a disciplined person, can lead you to the best skin which you can get. Yeah, that you can term it as a Korean skin, or you can term it as a better skin of Rudrik. And which is what we explain them, and we do the various procedures like peels, like lasers, like giving them good products, bringing them to the office regularly, and seeing how it is affecting them and making them accountable to take care of themselves. And slowly over time, over maybe a few months, you get to what is a Korean skin.
If we come to a short-term case question, say as an example, say I'm getting married next month and my fiance is also getting married next month with me. What sort of treatments can they look at?
Oh, fantastic. So what we do during these bridal seasons is we do a lot of bridal makeover, and it is there for both males and females, both, of course, their relatives as well. And it all depends on when the bride and groom are having the final function and when they come to me. So we have certain creatives which we have made and put it up on our pages on Instagram as well, wherein how soon you should go and see your cosmetic plastic surgeon, and he will suggest you treatments accordingly. If you are far away, like if you are 1 year to your treatment, we can do big things like surgeries also. We can do a hair transplant for a guy. We can do a hair and skin treatment for the lady. We can do liposuctions and major surgeries on someone, because that will take some time to recover, and within 3 to 6 months you are in the best body shape as well. Yeah, so first is that. Second, if you are like around 6 to 9 months away, you can do lesser invasive things, like you can do Botox, you can do fillers, and closer to the treatment you will do lasers. But still we will not do lasers like 2 to 3 weeks from your main function. So we'll do, after lasers comes the peels. The peels are for acne treatment or for pigmentation treatment. They have a smaller downtime. They have a downtime for around a week. A laser has a downtime for around 2 weeks, I would say. And absolutely closer to the date, you do treatments which are like almost zero downtime, like a hydrofacial treatment or a Hollywood peel. Certain things like that, so that you can do that, and even next day you can go and attend your function. So it all depends on the time when you approach your service provider.
So, doc, you also mentioned that that you do hair transplant. So there's a major challenge of balding that people, mainly
Yes.
men, feel
Yeah.
they don't feel confident. So
Absolutely.
what's with the hair loss? What's the major reason behind hair loss?
Yeah, so these days, a lot of young kids are also facing a lot of hair loss issues. Primarily, it is male pattern baldness, which is related to your heredity. Now, this can come either from the mother side or from the father side. या मेरी टाइम्स जैसे तो हमारा पप्पा ने तो आटला बदा वार्ड से मेरे फादर को काफ़ी बाल हैं, मेरे दादाजी को भी बाल हैं, मतलब उनकी उम्र जैसे कम है पर है, तो मेरे को क्यों, तो वो मदर के साइड से भी आ सकता है. So I asked them whether your uncles or your nana from your mother's side, grandparents from your mother's side, are they having hair loss issues? So heredity is the primary cause of hair loss, primarily in males and females. Other things like, of course, your stress or your lifestyle, habits like smoking, all these also affect your hair quality, density, and hair loss a lot. But primarily it is heredity. And hair transplant is, yes, very common. Hair transplant is primarily common in males. We of course do it in females also, but males, yes.
So if you were to, what should two kind of people we'll talk about, what should they be considering? One is that who are clearly getting bald, either piche se and all of that, it's going out. Another is who are in the starting stage, like even someone like me, for example, over here, if you see, it's going back. I can see over the years, it's going a little bit back. Dheere dheere ja raha hai. So what should they be considering? Where does hair transplant come in there?
So basically, it is the male pattern baldness goes from grade 1 to grade 7. So any and everyone who has any issue related to hair should directly go and consult a cosmetic plastic surgeon on the first day. Don't have ideas, your own ideas in your head कि एक बार पूरा खाली हो जाने देता हूँ, बाद में जाता हूँ. ऐसा नहीं होता है. अभी घर जल रहा है, एक रूम जल गया है तो पूरा घर जलने देता हूँ, बाद में नया घर बना लूँगा, नहीं होता है. डैमेज को लॉस कर सकते हैं, एंड डैमेज कंट्रोल इज बाय अ लॉट ऑफ नॉन सर्जिकल ट्रीटमेंट्स. सो इनिशियली वी डू a lot of medication. There are serums which we use in morning and evening. There are tablets of biotin, maybe finasteride tablets, and treatments like PRP, platelet rich plasma, which medical management of hair loss is extremely common in my practice, and it is done by both males and females. In fact, it is more common in females because hair transplant is not as common or as much as required in females. And medical management should be done immediately when you think that you are having any problem in your hair. What will be done will be decided by your doctor, and it will be told to you, and everyone get results. First thing is you will start seeing that your hair fall has decreased over the first 3 to 6 months, and beyond 6 months to 12 months, as you continue your medical management, you see new hair growth as well. So even the density improves. Yeah. So this is for cases which are initial cases. Cases where there is already hair loss which has happened, which is known as balding. There are no hair follicles or very few hair follicles in that area. Those are the cases which are for hair transplant surgery. या तो अगर बात किया जाए तो खेती के लैंग्वेज में मैं अगर आपको बेसिक समझाऊं तो जहाँ पे बीज है ही नहीं, वहाँ पे आप पानी डालोगे या फर्टिलाइज़र डालोगे तो आप दोनों वेस्ट कर रहे हो. वहाँ पे आपको पहले बीज डालना है, विच इज़ अ हेयर ट्रांसप्लांट सर्जरी. पहले बीज डाला, बाद में पानी और फर्टिलाइज़र डाला, ग्रोथ होगा. बट जहाँ पे आपके पास ऑलरेडी बीज हैं, वहाँ पे आप पानी और फर्टिलाइज़र डालोगे. दैट इज़ इफ़ यू हैव हेयर एंड यू वांट टू growth to happen, that is the place where you can do medical management. If there is nothing, then do surgery first and then medical management. Anyways, you have to do after surgery for the hair growth and to maintain the existing hair.
मतलब टैबलेट ऑइंटमेंट सीरम कुछ भी लगा लो, हेयर फॉलिकल गया तो गया
खत्म. तो सिंपल स्ट्रेट फॉरवर्ड सर्जरी करो, जो बहुत इजी सर्जरी है. बेनलेस है, सुबह से शाम का काम है, बीज डाल दिया, बाल उगने वाला है. I have done hair transplant surgery for a 19-year-old. I have done hair transplant surgery for a 79-year-old also. Okay. And both of them have got results.
Okay.
Yeah.
And what are the common reasons that people, during your consultation, what are the main reasons that they come to you? Is there some self-confidence low हो जाता है लोग का? Major reason क्या होता है?
Yeah, so basically, in Indian culture, hair is still important. You know, in Western culture or people in the US, or they just go bald and they talk about, you know, if I start losing hair, then I'll just go bald. It is okay. It is a personal choice. And no one better to choose that for you than you. you can do that, but still their culture, it might be okay, or they don't care, that's okay. But in our culture, we care, other people care, and we sometimes have to care because other people care. And hair is an important part in our culture, and we better take care of it. And if it is your choice that you don't look good without hairs, then care for it in the early sitting. And of course it will cause a lot of boost to your self-esteem, self-confidence. You look good, yeah, just try to photoshop yourself without hair and see sometimes how you look.
I was actually imagining right now कि
so
beard रखना पड़ेगा.
it is not good, yeah. So people still want hairs, and it looks good on you. There's a reason why hair, God has given you hair, yeah. Otherwise there wouldn't be hairs. Males would humans would be born without hairs if it was not for some reason, and if you're not going to look good. And so we better take care of hairs.
Then talking further about Indian culture now, what we see, our mothers typically tell us oil your hair. तेल लगाओ तेल लगाओ तेल लगाओ. And I'd say the young are very notorious कि वो तेल नहीं लगाते, स्पेशली कॉलेज के लिए बाहर चल गए कुछ गए तो खत्म, तेल लगाना एटलीस्ट फॉर द बॉयज तो गया. Does that actually play a very huge role, or there is that वो बोलते हैं ना natural oiling भी होता है? Is that significant enough? How does that work?
Yeah, so all these practices which our mothers or our ancestors have done are for a reason. They are not wrong. They are right only. They are good only. It is up to us where and how much we are able to stick to them. So basically, oiling is not only oiling. When your mother or your grandmother very fondly used to do that massaging for you, it is that massaging action, that deep massage with the oil, when the hand goes over your scalp and does that, that improves the blood supply. That increase in the blood supply to your hair follicles is the thing which actually causes hair to stick and grow. So that was the reason. People have forgotten that reason. या खाली ऐसा थोड़ा सा हेयर लेके ऐसे ऊपर डाल दिया, कुछ नहीं होने वाला है. एंड सेकेंडली, इट इज़ नॉट द ऑयल पर से. सी, ऑयल इज अ एजेंट टू कॉज दैट मसाजिंग एंड टू इंक्रीज द ब्लड सप्लाई. पर से दिस ऑयल इज डजेंट हैव द कैपेसिटी टू ग्रो योर हेयर. What grows your hair is the medications like minoxidil finasteride serum or a triple peptide hair growth serum. These are actual medications which go inside and cause hair to grow. The oil and the shampoo which we or normal people give more importance to has to be given less importance because they are just a maintenance agent. They are not agents which are going to go inside and cause hair growth. The medication, the serum which you massage well is going to cause hair growth. These are only going to maintain it. But if you do that maintenance, your hair will be better. And if you use the serums, your hair will grow.
So basically, are you saying that, say, if I'm out of my house, I'm in college in a different city, and if I don't oil my hair, but I use a comb or do something to massage my head time and again, it is enough?
Yeah. So, and that something will be generally a serum or an oil.
Okay.
What else will be there, right?
Correct.
So you use, and even if you do that to 2 to 3 times a week, basic things, yeah. All what our parents have told us, the basic things: eat good food, take care of your hygiene, take care of your hair, take care of your skin. Basic things if you do, and for the hair also, if you do those basic things 2 to 3 times a week, you shampoo them well, you take care of them well, you groom them well, and you use some oil, so any oil. For a non-medical person, I am telling. If you are taking the advice of a doctor, he will give you the right things. But any oil you use for 2 to 3 times in a week at least, and you take care, it is going to stay well.
Coconut oil, castor oil, any oil is fine.
That doesn't matter. See, in my practice, I have a particular oil which I ask my patients to use, and it is a very simple formulation. It does have coconut. It is a coconut oil based formulation, and it works well. But more for hair growth are the scientific medications and the serums and the tablet which causes hair growth. This is for maintenance.
So what are the common things that you have, like during your consultation, that people come to you and say, sir, हमने ये try किया, वो try किया है, कुछ काम नहीं का, hair transplant finally करवाना है. तो what are those things that people have already tried, wasted their time, money and energy?
Instagram ads, products. I don't want to name any products. There are ads of products these days जो बोलते हैं कि यार hair transplant करा रहा है, hair transplant क्यों करा रहा है, उससे अच्छा ये तेल लगा ले, ये कर ले. अरे भाई, मतलब बोलने के लिए तुम कुछ भी बोल सकते हो. All that is marketing gimmick. I would really request our friends and listeners to please not fall for those marketing gimmicks. Go to a doctor. यार पढ़ाई किया है उसने, उसका काम है ये, इतना सारा मेहनत किया है. You know how difficult it is to get into medicine, how difficult it is to score marks continuously, be a good doctor, then further go ahead, and there is a reason why he's sitting there. Yeah, so kindly go consult whoever you trust. I would say a cosmetic plastic surgeon, or even for that matter a dermatologist for your hair scalp care, and go see them. Don't buy products just off Instagram or Amazon, these gummies or these some tablets or some sort of serums, and start using them, and then realize after spending a lot of money and more importantly spending a lot of time, and then going to the professional and finding out that you could have done easier, much better, maybe sometimes cheaper options with better hair growth.
Can we talk a little bit about pricing as well? So when you look at hair transplant, how does that work? How much is someone looking to spend?
Yeah, so basically my pricing in my practice depends on the kind of technology I am using to do hair transplant. See, we are doing FUE hair transplant, which is follicular unit extraction, which is the most latest methods in the world. We use the pen for harvest, the sapphire knife for the holes, all the latest things which are there in the world we use. And we adopt immediately. I generally don't price my patients depending upon the kind of grafts I am going to use, because I find that very commercial. There are packages which of course start from a lakh and above, and depending on the kind of technology I am going to use for that case, and the patient has to choose that. There are 3 packages which are created, and I say that all 3 packages are going to have enough number of grafts which you need. Yeah, so number of grafts are going to be enough for all of them are going to get results. It is just the kind of technology which I'm using which is going to make the healing better, the results more natural, the results more dense, and that option all our consumers must have to select for themselves, and they are given accordingly.
So when you say grafting, harvesting, what is all that? If very
So hair transplant basically is a 3-step procedure. It is very easy. The back of your head is your donor area, primary donor area. The chest, the chin and the chest are your secondary and tertiary donor areas, which we go to only if we don't have enough number of grafts here. So number 1 is the donor area, where we harvest the grafts from. That is, we pick the grafts from here. Second step is you make holes over the recipient area where you got to put the grafts. You make holes. And the third step is the harvested graft is put back into the holes. So only 3 steps: removal, holes, and putting it back. So harvesting, slitting, which is making holes, and transplanting it back inside is the 3 steps. That's it. That is all about hair transplant surgery. Now the various techniques are how you harvest, what techniques you use for harvesting, what instrumentation you use for harvesting and putting holes is all a different gamut and makes 4 or 5 techniques. That's it.
Okay. So it's completely natural. Nothing external is being
hair
implanted.
transplant is the most natural thing.
thing.
People कहते हैं कि यार मेरे को natural रहना है, इससे ज़्यादा natural तू रह ही नहीं सकता है. तेरे खुद के बाल यहाँ से लेके यहाँ रख रहे वो उससे ज़्यादा natural क्या हो सकता है?
Of course, yeah. Now, say when we talk about something like breast enlargement, right? I assume there is some sort of filament that you put in the breast to make them larger, just as an example, right?
Yeah.
Now, does that have any direct relation or correlation? Are there any studies of those fillers in the breast to do with breast cancer?
Okay, so there is a very deep science to this. Per se, what we use is silicone implants. Silicone implants are medical grade silicone implants. These are extremely safe products. They are sterile products. After a lot of research over the years, they have been used in human usage for many years now, and it does not directly impact you to get the bad cancer which a normal person knows, but there are certain few variants of minor things which can happen. What I do in a consultation of a breast enlargement patient is we examine them, we find out what's going in their mind, what do they want, what is actually possible, how big bodies they have, what kind of implant actually can I fit into them, whether that is going to match what they are looking for, what I can do, what is available. All the three things have to match, and the pros and cons are discussed. As such, it's a very safe surgery. Of course, it's again a reversible surgery, so it is not something which is permanent. I do a breast implant today, and after 2 months or 2 years or 20 years, a lady doesn't want it, I can just open and remove the breast implant. It's a half an hour procedure. So first of all, it's reversible. People don't need to get scared of it. Secondly, if you get into a lot of medical science and scientific articles into what all it can cause, it is a very deep study, and I think it is beyond the purview of this talk. But overall, I tell my people that there is going to be a substance which is behind your breast. So in fact, sometimes it is easier for you to detect small little lumps even if you are going to get it in future, because there is a stronger background there. So to feel a small lump for the lady herself during breast self-examination, it is easier. So in fact, smaller lumps or smaller bad things which are anyways going to come because of heredity or genetics are easier for you to examine, and the breast implant in fact helps you to detect them early. You understand? And actually, this actually happens. But per se, the implant causing major problems is quite rare. If you say whether it is 0%, it is not zero. There is nothing 0 or 100 in medical science. There are certain things which can happen on the long term, which are extremely rare, which we explain to the patients, and they are well aware of. Even I think before coming to us, they are quite rare also. So the size of the breast or the growth of the breast is not in control of anyone. There are, maybe you'll ask me later, but there are no creams or no procedures or no maneuvers, physical maneuvers with which you can cause the enlargement of breast. It is impossible. All that is marketing. The only thing which actually can increase or decrease the size of the breast is surgery by a cosmetic plastic surgeon. Full stop. Yeah. So then if that is the case, then you do surgery for breast enlargement on people who are endowed with maybe smaller size of breasts, or maybe they have undergone mommy makeover, they have done breastfeeding, and then the size of the breast has involuted, has become small, and then they don't like it because pregnancy is not a disease. Earlier they were in a size and shape of the body which they liked, so they have all the right to get back there, and we are the people who help them to get that.
So is it common for a plastic surgeon to say no to a client that no, I won't do it?
Oh yes. So a very deep question. If I meet 10 people for surgery consults, I would easily refuse 4 or 5. That's a very high number in my consultation, because I talk to my patients a lot. Not only before surgery, even after surgery, I like to keep a lot of rapport with them. I am very much approachable. All my patients know that I'm always approachable. I always give an answer via WhatsApp. If I feel that this particular person is being coaxed into surgery, or this particular person doesn't want this surgery for herself or himself for the right reasons, which I think are right for my practice, and I discuss it also very clearly with them, that what are you looking for out of this, and if the expectation setting and the reality is matching, then I will go ahead and do the surgery, or else I'll very politely refuse that maybe this is not the right time for me to do this surgery on you.
Ever since I was little, I had seen one thing: Michael Jackson.
Yeah.
He was
lot
not,
of misconceptions.
Yeah, he was never fair skinned, but I think towards the end he was. So how does that work? How does one get from darker skin to fair skin, and is it actually doable for a normal person who is not a celebrity?
Yeah, so I'll just dispel quickly a few myths about Michael Jackson. See, there are people with great power comes great responsibility, but with great power and great money sometimes comes great wrong ideas into your heads. So a lot of people would have told Michael Jackson that this is the limit, don't go beyond this. इतना जो आपने कब से बात कर रहे हैं कि भाई इधर तक ठीक है, इतना रियलिस्टिक है, बट एक लेवल के बाद बंदा सुनता नहीं है ना, तो उसने बहुत सारी चीज़ें ऐसी भी कराई जो नहीं करानी चाहिए यार, जो मतलब, और सी मार्केट है यार, मार्केट में तुम किसी को 4 बार बोलोगे तो कोई तो बंदा तुमको मिल जाएगा हु माइट बी अ क्वैक और हु माइट नॉट बी द राइट पर्सन हु विल स्टिल वांट टू डिलीवर इट टू यू. यार, यू गिविंग मनी, इट इज़ अ ट्रांजैक्शन. So I would say that that is what maybe I presume that went wrong with him, that he did not know where to stop and he did not know when and where to consult the right people. Yeah. So coming to the dark skin, white skin thing, all skin types are good. Okay, we as cosmetic plastic surgeons don't think that white skin है तो बेहतर है, but हाँ, there are scientific treatments wherein you can lighten your skin tone. I'm not saying you become dark to white. There is nothing like 0 to 100 again in medical science. Okay, there is always a gray zone. तुम अपने स्किन टोन को लाइटन कर सकते हो बाय एजेंट्स लाइक ग्लूटाथायन, which you can either take intravenous IV glutathione, which is safe. Okay, everything is, see, water is, if you drink you live, but you can drown in water. अभी वाटर की गलती नहीं है, गलती उसकी है कि कौन सी क्वांटिटी में है वो, और तुमने क्या किया उसके साथ. अभी ग्लूटाथायन के ट्रक के अंदर घुस के तुमको नहाना नहीं है. Okay, so glutathione is a product, it's a medical product which should be given by a doctor in the hospital in a particular dosage, in a particular time period with a interval. Okay, so the product is not wrong. तुम कितना ले रहे हो, कितना सामने वाले को फोर्स कर रहे हो देने के लिए, कितना जल्दी धीरज से करोगे, तो विथ IV ग्लूटाथायन, ओरल ग्लूटाथायन प्रोडक्ट्स, लेजर्स, पील्स, you can lighten your skin tone. You can become little fair also, but realistic fair. And if you compare that काजोल, बिपाशा बासु, प्रियंका चोपड़ा पहले ऐसे थे और फेयर हो गए, तो हाँ, उन्होंने भी ट्रीटमेंट्स की होंगी. अभी हियर वी आर नॉट डिस्कसिंग किसने क्या किया है. ओके, बहुत सारे लोग ने बहुत कुछ किया है, तो किया है, क्या हो गया यार, दैट इज़ देयर चॉइस. स्टॉप जजिंग पीपल फॉर देयर ओन चॉइसेस. यार, दैट वाज आल्सो हर चॉइस, माय चॉइस, हर चॉइस करते हो तो वो भी उनका चॉइस है ना यार. So first thing is stop judging people for their choices. We should not do that. And with scientific treatments, you can make your skin lighter. And when you continue to take those products, you can maintain it. Yeah, and of course, as I told you, video tips और tricks भी होते हैं. So अब तो AI आ गया यार. You don't know whether I and you are actually talking right now. You know, which we are. But then with AI, so much can be done. And even before, the video tricks and tips will also make them look more fairer than they are, but they have become fair from where they were because of scientific treatments.
Basically, for a normal person, it is possible.
It is possible.
Not from dark to super light, but
yeah.
few skin tones.
Yeah, 1 or 2 skin tones you can become lighter.
Okay. And is it super expensive?
No, it's not super expensive. No, see, injection glutathione, I would say around 16 to 20 sittings of injection glutathione. So you take those injections once a week. And then you can increase the dosage of glutathione which you take once a week. So it goes, the treatment, IV treatment goes for around 2 to 3 months. And every injection treatment would maybe cost you around 3,000-4,000 rupees.
So similar to a hair transplant, basically.
Hair transplant is it's more because it's a surgery. This is not a surgery. This is a non-surgical thing, so it will be less.
Okay,
in fact,
makes sense.
But then and then after those IV treatments, you take oral tablets and certain products and treatments, and you will continue to maintain it.
And the effect, does it last
for so in all these things again it's a maintenance. मैं लोगों को बोलता हूँ कि यार गाड़ी में पेट्रोल जितना डालोगे तब तक चलेगी. सो तुमको जब तक रिजल्ट चाहिए कुछ ना कुछ करते रहना पड़ेगा. तुमने 6 महीना 12 महीना टोटली बंद कर दिया. सी, सन इज देयर, योर स्ट्रेस इज देयर, you are going to tan, you're going to, it is your skin, so the skin is going to work the way the skin works. If you want to look and remain lighter, then you protect yourself from the skin, have a balanced life, do the scientific treatment which your doctor is telling, and then continue to do them to see the result.
So with makeups, I was talking to a friend. He mentioned he works in a corporate at a good position. So he said that I have seen few people, they're always with makeup. So is there something with a permanent makeup? They're always even guys, not just females, but even guys, that they are, since they are client facing, they have to meet CEOs or maybe millionaires. So they're always tip top.
So I would say Yeah, there are things like permanent makeup. I'm not very fond of them, like permanent lip or permanent eyebrows, or it is a giveaway. Like you yourself told that that it's a giveaway. And I personally, although I'm a cosmetic plastic surgeon and I deal with people and their expectations and their desires, I always want to keep things realistic. Keep things subtle, keep things natural, keep things realistic to an extent that it doesn't show on your face. I do breast surgeries, I do breast augmentations. It doesn't hit you on the face. There are expectations which you match up to, but then you also guide them that this will look good on you, this will look over the top on you. And I primarily like to work with people who have the expectation match as to what I have, or else you can politely refuse that this will not look good on you. Or maybe I'm not the surgeon who would like to do this and this for you. So similarly, permanent makeup and all, I am not very fond of. You can keep that for maybe particular occasions, but all the time having that and maintaining that is also a task.
So I wanted to ask you around the pricing around this.
Yeah, so they are generally treatments which are more of done in parlors and all. Plastic surgeons are not involved too much into it. Of course, there are things like vitiligo patches, like in Gujarati we say that safed dag or code. Those vitiligo patches, if they are there, then there are various treatments a cosmetic plastic surgeon does, including surgeries, melanocyte transplants, a thin skin graft to cover those white patches. But there is one thing known as a sort of a permanent tattooing, medical tattooing for vitiligo patches. That is sort of a permanent makeup which a plastic surgeon will do if you have small white patches maybe on your lip or on your face or some areas which are visible. But otherwise, permanent makeup for lips and all, no. Yeah, microblading or medical tattooing of the eyebrows is something which an interested cosmetic plastic surgeon may do. We do that in our hospital, and that gives you a very, very natural eyebrow. See, what the parlors do, with all respect to them and their training, is something which they are trained in. But when a plastic surgeon does it is done with a lot of finesse, and it doesn't look like a done up eyebrow. It looks like a natural
That is
eyebrow, which
different.
is darker and better.
So what is the difference? So to my understanding, in a parlor, they'll basically cut your eyebrow in a particular shape, correct?
That is different. What you maybe have not come across or seen is something known as permanent eyebrows. Permanent eyebrows, when they use the term permanent eyebrows, we use the term microblading or medical tattooing. So there are very special dyes which are taken on special needles, and special strokes are made in the direction of the eyebrow, which causes them to look fuller, denser, younger, and natural.
So basically, it's like a tattoo, not a
It
physical
is like a
hair or
tattoo.
something.
No. It is not
Okay.
like the kajal or something.
Okay.
It is actually going in the skin,
Okay.
and this lasts for around a year or two.
And parlors do that as well?
Unfortunately, yeah. Yeah. So there are certain. So we wouldn't want to get into. There are a lot of things which happen in parlors which are actually medical treatments, including PRP, including lasers, including laser hair removal, and a lot of other stuff which I believe that it should be done by medical professionals at hospitals. As you are asking me, if there are any minor allergies or complications, then you can't deal it. You don't even have the knowledge or expertise to deal it. These are medical things, and rushing a customer or a patient at that time to a medical professional is not professional, and it is very scary, risky, and you should not be taking that risk. Anything related a little more invasive in the skin or hair should be left to medical professionals. It takes a lot of years of training and lots of hard work to do that, even for a surgeon, and I think it is better left to them.
So with social media, has your matlab, has it increased that the number of people that can come to you for of course, because of the awareness consultation, that they wish to be looked a certain way on social media? Is that a reason that
I would say yes. So both the things. Social media has also increased their awareness and education part, and it has also led to sometimes unfortunate comparisons, which is something which I again don't agree to, or I don't want my people to do that, I tell them that you can become a better version of yourself. So our tagline is be as you wish to seem. You can become that as whatever you want to be, a newer version of yourself. But at the end of the day, everything and every comparison is to yourself. Yeah, so if you are comparing to yourself and want to become a better version, you are most welcome. And of course, people look at themselves more, and people want to post pictures, videos, and if there are certain tweaks they can do to themselves and they feel that this is good, then why not? Because it is safe, it is advanced. These procedures are generally daycare procedures. Maximum they stay in the hospital for one night, and the healing time is quite fast, and people can get six-pack abs. They are working in the gyms.
So how do you manage usually the expectations when someone comes to you? There would be several people के हमने ऐसा सोचा था ये हुआ नहीं. So how do you bridge the gap between the expectation and the reality that comes out after your surgery in plastic surgery, hair transplant? Yeah. Before after both you can share. Yeah.
All the expectation setting has to start in the first consultation. You cannot give them reasons or explanations after your surgery. That becomes a totally different ball game. So a minimum time I would take for a new consultation is half an hour to 45 minutes with each patient, minimum. If I would like to, depending upon the kind of person the patient is, the kind of complexities the patient wants to get into and find out, depending upon my assessment, I would have at least minimum 2 consultations before I take a patient for surgery. Yeah, so this gives me enough time with them. This gives them enough time with me. As far as a patient is assessing a doctor, the doctor is also assessing the patient, whether he is the right patient for me or not. And this comes with the kind of expectations the patient has and the kind of reality I will give him. So all these things happen in the first or the initial consultations before the surgery. You tell them what is possible very clearly. You tell them what is not possible very clearly. You tell them how long will this take very clearly, and you will also tell them what it takes out of them to get that result. अकेला मैं सर्जरी करके उसको रिजल्ट मिल जाएगी ऐसा नहीं है. Especially for body contouring procedures, I do the surgery and I give you the best result. Okay, whichever is in my hands. I will never proclaim or tell someone that I am the best in the world, just next to God, और ये सब बकवास होता है, ऐसा कुछ नहीं होता. I am a human. I have my own limitations. I have certain procedures which are good in my hand, which I will be practicing more commonly. So I have the confidence for that, and I will tell them that I am good at it and I will be able to give you this result. But then you have to follow also. And if they follow, if they do the things properly, they get their result. And when this has been told nicely before the surgery, they know कि भाई डॉक्टर ने इतना इतना मेरे को बोला था और मैंने इतना इतना तो किया, इतना इतना नहीं किया है. तो a sane patient will know what to go back and ask. अगर थोड़े ऐसे हैं जो जिनको तुम एक्सप्लेन करी, सारा एक्सप्लेन किया है, फिर भी उन्होंने नहीं सुना या अनसुना कर दिया, या there are out of 100 people there are going to be 2 to 5 people who are going to be difficult for you to handle. I just wish them best. I tell God bless, and I still tell them that whenever you need me, I am here. You can contact me, but if you have wrong ideas in your head, or if you feel otherwise, then I'm sorry.
At the end of the day, it is a service business, and of course you can't make everybody happy 100%.
Lord Krishna has told in Gita and Mahabharata, only the Pandavas were happy with him. Only 50%. 50% Kauravas की whole team was not happy with him. कृष्ण भगवान से तुम खुश नहीं हो यार, मैं तो यार नॉर्मल इंसान हूँ. But still, we take extreme efforts to be approachable, to be available. In fact, my wife scolds me for that. She literally scolds me for that. You are extremely available. You keep answering to every nonsense question which is put forward to you, even multiple times. And I do that, yaar. See, you have to be a good person. And even if you are a good person, the opposite person, 2 to 5% people may still think that you are not good or you are not good enough. You can't really do anything for that. You just keep doing your best, and that's it.
So if you had to give someone advice, like if there's a person getting into wants to consult you, then what are 3-4 things that they should consider before selecting any a surgeon like you?
Thing is, I am an executive council executive committee member of the Indian Association of Aesthetic Plastic Surgeons. So IAPS is a body, Indian Association of Aesthetic Plastic Surgeons, which has executive members. There are 7 to 8 members from all over the country who are selected. I am the one from Gujarat who is there, and they have certain directives. They have a page of their own, the website of their own, the directives of their own. How do you select your cosmetic plastic surgeon? What are the things you should look for? First of all, what procedure should be done by which specialty? Nowadays, we see that a lot of cosmetic plastic surgery is done by other specialties which are not plastic surgeons, who sometimes even go ahead and proclaim them as plastic surgeons and do that. And there's a lot of misguiding which happens in the society. So, our association has very clear guidelines which the people, if they are smart enough and they look up for the right people with the right intention, they will come to the right place. Also, every cosmetic plastic surgeon in the country has their own pages, and who makes reels, who gives talks, who does podcasts, and always tries to work very hard to give the right information to the people. But it is also up to the people to take that. Many a times, some people would consider that the same hair transplant surgery done by a plastic surgeon is 50% cheaper at a homeopathic doctor's place or a dentist's place or a dermatologist's place. And now, if you are giving more importance to cost than quality and safety, then God bless you. But if you think that you are important and this is something which you want to do once in your lifetime, then please go to the best place. The best thing is go consult people, go talk to people. I don't think any patient or any consumer or any client is a fool. No one is a fool here. They are also smart enough to understand that how much is the experience of the opposite person, whether he has the right qualifications or not. So the best thing, in short, look at the degree of your professional. If you are looking at their hospital, a right doctor will always have the hospital name, the doctor's name, and the degree written even on the board outside the hospital. From far away, you can see who's the doctor, what degree does he have. Go to certified degree holders who are in the market for some time and who are doing this exclusively, and you will go to the right place.
Then, just to put an end to this, if there is any key takeaway that you'd like to give all our listeners of what they should keep in mind when it comes to plastic cosmetic surgeries, what would that be?
Okay, so a key takeaway is, don't let anyone judge you for your choices. Okay, you be clear in making your choices. Don't be shy. You want this, first be very clear to yourself. Clearly communicate to your spouse or your family that this is my choice. I want to do this for myself and I have reasons for this. If someone asks you, please explain them. And then you don't start judging yourself कि यार मैं ऐसा क्यों कर रहा हूँ, क्या कर रहा हूँ, सही कर रहा हूँ कि नहीं कर रहा हूँ. And don't let other people judge you for this. Okay. And the society also has to learn to be more inclusive, be more accepting. People have their own reasons for their choices. No one is a fool here. And let us also respect that. And that is a takeaway which I would like to give people, that be as you wish to seem, man.
And it was a wonderful session that we learned a lot of things around hair transplant, and of course a lot of questions that we personally had around several plastic surgery related questions that you answered.
Thank you so much, Rudrik and Tirth. And I would like to add one more thing, last thing. So what is my vision for the future? So my vision for the future of cosmetic plastic surgery in India is that people should be able to come out and discuss their ideas, their cosmetic plastic surgeries, their work, their choices with other people openly. You know, it is started to happen in the West. Ladies maybe sometimes discuss their plastic surgeons on a coffee table, and they have done this, they like this, they have done this here, and they have liked this, they have done a lipo, and now she fits into better clothes and she likes this. We are still a very stigmatized society. We judge left, right, and center. We are very harsh to people. My vision is that we stop doing all these things. We give other people a chance, and we start discussing and be more open to what we have done, so that other people will have the right information. See, even the celebrities and whoever are in the place of influencing people, if they come out and tell that they have done certain things which have really helped them for whatever it has helped them, it will make other people's life easier. They will not think that इसने ये जादुई गोली खा ली या इसने सिर्फ डाइट और एक्सरसाइज कर लिया या ये हिमालय पे जाके उल्टा लेट गया जिसके वजह से इसको ये रिजल्ट मिल गया. अरे भाई उसने ये सर्जरीज और ये चीज़ें कराई है तो ठीक है, मान लो ना यार, और उसमें कोई गलती नहीं है. सो अदर पीपल कैन बी गाइडेड बेटर एंड दे विल ऑल्सो फील कि हाँ मैं ये चीज़ें इतना डीप में करूँगा तो ही मुझे ये चीज़ मिलेगा, मैं शॉर्टकट करने से मेरे को ये चीज़ नहीं मिलने वाला है. सो माई विजन इज़ टू let us be open and less judgmental. And
that's it for today's episode of All That Matters. We hope you gained valuable insights from Dr. Saumya Nayak's incredible expertise in plastic and cosmetic surgery. If you enjoyed this conversation, make sure to hit that subscribe button so you never miss an episode. Your support helps us bring extraordinary guests and life-changing stories to you. And if you found this episode helpful, share it with a friend who might be considering a cosmetic surgery or might be just curious behind the science of it. One conversation can inspire a change, and this could be that change. Thank you for tuning in for this episode of All That Matters. See you next time.